What I have watched happen to English friends taking amlodipine, Losartan, or Lisinopril, most doctors simply do not have time to explain in a 15-minute visit. If you take one of these three for blood pressure, there is a real chance a symptom you have been blaming on age, stress. Before we go further, because understanding what your own body is telling you could spare you real trouble down the road. I am Amish, and while I am not a doctor, our community has spent generations watching closely and asking the right questions instead of guessing. There are several things worth understanding about these three medicines. Not because your doctor is hiding anything, but because rushed appointments rarely leave room for the full picture. By the end, you will know which symptoms are simply your body adjusting and which ones deserve a phone call today, not next week. Let me tell you about my friend Walter first. His story shows why paying attention matters.
Walter is 73, an English neighbor down the road who has helped us with hay equipment for 20 years. Careful and steady, the kind of man who reads every instruction twice before doing anything, never one to complain or make a fuss over small discomforts.
He took his amlodipine exactly as prescribed, never missed a dose, kept every appointment on his calendar circled well in advance. His blood pressure numbers looked wonderful, his doctor pleased at every visit.
But 3 months in, he mentioned to me, almost in passing, while we were fixing a fence line together, that his boots had stopped fitting right by evening, that his ankles looked swollen most nights, tight and puffy in a way that had never happened before. He assumed he was simply gaining weight, getting older, slowing down the way men his age were supposed to slow down. Nothing worth mentioning to a busy doctor. His daughter Karen happens to be a nurse, and when she visited that same week and saw his ankles for herself, she sat him down at his own kitchen table and explained something nobody in his rushed 15-minute appointments had ever laid out clearly for him. What his medicine was actually doing to his body, and why that swelling was not weight gain at all, but something with a real explanation behind it. That conversation, sitting at Walter's kitchen table with a pot of coffee between us, is where this whole video begins. Number 9 is understanding that these three medicines are not interchangeable, not simply different brands doing the same job with different names slapped on the bottle. Karen explained it to Walter and me plainly one afternoon at his kitchen table. Patient, the way a good nurse learns to be with folks who have never studied any of this before. Amlodipine is a calcium channel blocker. Losartan is an ARB. Lisinopril is an ACE inhibitor. All three lower blood pressure, yes, but each does it through a different pathway inside the body, working on different parts of the system entirely, and each pathway creates its own distinct pattern of side effects because of exactly where and how it works. The common misconception is thinking all blood pressure medicine behaves the same way. So if a friend complains of one thing on their pill, you assume yours will do the same. Or if you feel fine on yours, you assume there is nothing worth watching for at all, no pattern worth learning. Walter had assumed his pill worked exactly like his brother's, who took Lisinopril for years without any trouble, and could not understand why his own experience with amlodipine was turning out so differently. Once Karen explained the three separate categories, laying it out simple on a scrap of paper at the table, it clicked for both of us at once. The name on the bottle tells you the family the medicine belongs to, and the family tells you the general pattern to expect, once you know what to look for. Number 8 is the swelling itself, what Walter was actually experiencing every evening without understanding why. Karen explained that amlodipine relaxes the small arteries more than it relaxes the veins, so blood flows into the legs more easily than it flows back out. And over hours of sitting or standing through a full day of chores, fluid slips into the tissue around the ankles and feet, pooling there quietly until evening makes it obvious. The misconception is assuming this means weight gain, weak kidneys, or a failing heart. 3 frightening possibilities that race through a person's mind before anyone explains the much simpler, much less alarming truth, that it is often just the medicine doing its job on the arteries, a little unevenly compared to the veins. Walter had been quietly embarrassed by his swollen ankles,
avoiding short sleeves and skipping the Saturday market some weeks because of how his legs looked by afternoon, ashamed of something he did not even understand well enough to explain to anyone who asked. He never once considered that a 6-week-old prescription might be the actual cause, blaming instead his age, his weight, his general decline, the story so many older folks tell themselves without ever questioning it. Once Karen named it plainly, sitting right there at his table, Walter felt real relief. Not because the swelling vanished immediately, but because he finally understood it was not his heart failing him, and that alone eased months of quiet worry he had never mentioned to anyone, not even his own wife. Number 7 belongs to my neighbor Dolores, 69, who takes Lisinopril and developed a dry, nagging cough that would not quit no matter what she tried. What made this confusing is that the cough did not start right away when she first began the medicine, the way she assumed any real side effect ought to. Karen explained that this particular cough can begin days after starting the medicine, or sometimes not until months later, which is exactly why so many people never connect the two things in their own mind. The pill bottle sitting quietly in the cabinet while the cough gets blamed on everything else in the house. Dolores blamed allergy season first, then dust in her house, then her furnace filter, replacing it twice at real expense before ever mentioning the cough to her doctor at all. The misconception is assuming a symptom that starts months into a medication cannot possibly be related to that medication, when with this particular drug, a late start is actually common enough that doctors expect to hear about it eventually. Once Dolores finally mentioned it at a routine visit, almost as an afterthought while discussing something else entirely, her doctor recognized it immediately as a known lisinopril side effect and adjusted her treatment without any drama at all. She told me afterward she wished someone had simply told her up front that this cough could show up anytime, not just in the first week, so she would have known to mention it months sooner instead of replacing filters and buying cough drops by the dozen. Now, before I continue, I need to stop and say something clearly, because if I do not, the rest of this video does you no good at all. A dry, nagging cough on lisinopril is uncomfortable, frustrating even, but it is not usually dangerous, and it is something to mention at your next visit, not necessarily a reason to panic or rush to the emergency room over. What is genuinely an emergency, and what Karen was firm with both Walter and me about, sitting us both down and making sure we understood clearly, is swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult in any way. This is called angioedema. It is rare, genuinely rare, but with ACE inhibitors like lisinopril, it can happen sometimes, without much warning, and it can become dangerous very quickly once it starts. ARBs like Losartan carry a smaller version of this same risk, though it happens even less often with that class of medicine. So hear the difference clearly, because this distinction matters more than almost anything else in this entire video. If I say cough that is worth mentioning at your next appointment, nothing more urgent than that. If I say your throat or tongue is swelling and it is getting harder to breathe or swallow, that is not a wait and see moment. That is not a call the office Monday morning moment. That is emergency care right now, today, without delay. Number 6 belongs to my neighbor Grace, 74, who takes Losartan and had been working hard to eat healthier, cutting her sodium and switching to a salt substitute she found at the market, proud of herself for taking real initiative with her own health instead of just following orders. What Grace did not know, and what nobody had ever explained to her before she made that switch, is that many salt substitutes replace sodium with potassium, and Losartan can already raise potassium levels on its own, quietly, without much warning at all. Karen explained that potassium affects the electrical rhythm of the heart itself, and that it does not always announce itself loudly. Sometimes it shows up as weakness, muscle cramps, tingling in the hands and feet, or an irregular heartbeat sometimes, barely any warning symptoms at all until a blood test catches it. Grace began feeling weak and tired in a way she could not explain,
and noticed occasional skipped beats in her chest that frightened her enough to finally mention it. And when her labs were finally checked, her potassium was high enough to need immediate attention that same day.
She had not been careless in the least. She had been trying to do everything right, reading labels, cutting sodium, following every piece of good advice she had ever heard. And that is exactly the gap that hurts people most. The well-meaning choices nobody ever connected the dots on for her.
Number 5 is about kidney numbers, and this one confuses people badly enough that they sometimes stop a medicine that may actually be protecting them out of a fear that turns out to be misplaced.
Karen explained that Losartan and Lisinopril are not just blood pressure medicines. In the right person, they can also protect the kidneys and heart over time, working quietly in the background, even when the blood pressure number itself already looks fine.
But when someone first starts one of these medicines or the dose increases, blood work can show a small rise in creatinine or a small dip in a kidney measure called eGFR, numbers that sound alarming to anyone who does not understand what they actually mean in context.
My neighbor Sharon, 71, saw exactly this kind of small change in her patient portal before anyone called to explain it to her properly, and she nearly stopped her medicine that same evening out of fear, certain it was hurting her kidneys after years of trying to protect them.
When Karen and her own doctor walked her through it together the next morning, the real question was never simply whether the number moved at all. The real question was how much it moved, and what the overall trend looked like over the following weeks and months.
A small, expected shift under a doctor's watch is very different from a dangerous decline that keeps worsening visit after visit. And guessing about the difference on your own, alone at home with a portal full of numbers, is exactly why lab follow-up matters so much more than people realize.
Number 4 belongs to Herbert, 78, who caught a stomach virus early one week and kept taking his Losartan every morning as usual because he was proud he never missed a dose, no matter how poorly he felt, considering it a matter of discipline rather than something worth reconsidering.
That night, he stood up from his chair to head to bed. The room spun hard and sudden, and he nearly went down before catching himself on the counter, his heart pounding from the fright of it more than anything else.
Karen later explained that vomiting, diarrhea, poor appetite, or heavy sweating can all change the body's fluid balance quickly, sometimes within hours, and a medicine that worked perfectly fine yesterday can act very differently today inside a body that has lost fluids it did not have to spare in the first place. Blood pressure can drop too low under those conditions. Kidneys can come under real strain trying to compensate, and dizziness or fainting can follow fast, sometimes with very little warning beforehand.
The misconception is believing that skipping a dose during illness is somehow more dangerous than continuing it blindly through sickness no matter what, when the truth is that illness genuinely changes the rules your body is operating under, and a simple phone call to ask what to do during a sick spell is never a bad idea, never something to feel embarrassed about asking.
Number 3 belongs to Clarence, 72, who took Lisinopril for his blood pressure, a water pill for swelling in his legs, and reached for ibuprofen several times a week for the arthritis in his hands, never once thinking to mention the ibuprofen to his doctor because he considered it just something ordinary from the drugstore, not real medicine worth bringing up during a busy appointment focused on his blood pressure numbers.
Karen explained that this specific combination, an ACE inhibitor or ARB, a water pill, and regular anti-inflammatory pain relievers together can quietly reduce blood flow to the kidneys and raise the risk of kidney injury, especially if the body is even a little short on fluids from heat, illness, or simply not drinking enough that particular week.
Clarence's labs eventually worsened over several months without him understanding why. His blood pressure growing more erratic, despite doing everything he thought he was supposed to do. And once the daily ibuprofen was removed and safer pain options were discussed with his doctor, things settled back down within a few weeks.
The misconception is assuming danger only comes from prescription bottles with warning labels and pharmacist consultations attached, when some of the biggest risks hide in ordinary over-the-counter choices, sitting right there in the medicine cabinet that never feel like real medicine at all, just something you grab for an aching joint without a second thought.
Number 2 belongs to my neighbor Mabel, 80, fiercely independent, living alone, hating to ask for help with anything, proud of managing her own household without anyone's assistance for years now.
2 days after her dose of amlodipine increased, she stood up in the bathroom in the middle of the night and felt the whole room tilt sideways without warning, catching herself on the sink just in time before her legs gave out entirely.
Karen explained that these medicines lower blood pressure, and the body sometimes needs real time to adjust, especially moving from lying down to standing quickly. And in an older body, even a few seconds of dizziness can end in a fractured wrist or a broken hip, injuries that can change a person's entire independence overnight.
Mabel had been told her pressure might drop somewhat when the dose changed, but nobody had explained what that could actually feel like, standing alone in a dark bathroom at 2 a.m, half asleep and unprepared for the world to suddenly spin around her.
The misconception is brushing dizziness off as simply standing up too fast, a harmless quirk of getting older, when sometimes it is the medicine working a little harder than your current body, hydration, or combination of other medicines can comfortably handle in that particular moment.
And now, number 1, the truth underneath everything I have shared with you tonight. The best blood pressure medicine is not the one that produces the prettiest number at your next appointment, the one your doctor smiles at and moves on from quickly.
It is the one you can actually stay on, safely, consistently, and honestly, because it fits your body, your other health conditions, your lab results, and your real, ordinary life, not just the numbers on a chart. Let me finish Walter's story, because it ties every single piece of this together into one whole picture. Once Karen explained his swelling plainly, sitting right there at his own kitchen table, Walter did not simply endure it silently, the way he had for months already. He brought it up at his next appointment, instead of quietly dreading his own medicine every single evening.
His doctor had options, a small adjustment, a different approach to managing the fluid, and within weeks, Walter's boots fit properly again, and he stopped avoiding the Saturday market he had loved attending for decades. Nothing about his blood pressure treatment had actually failed him.
What had been missing all along was simply the understanding, the plain explanation nobody had time to give him during a rushed 15-minute appointment focused entirely on the number on the cuff.
A medicine that looks perfect on paper can quietly fail in real life if a person hates how it makes them feel, does not understand its warning signs, or starts avoiding it without ever telling their doctor why, suffering in silence rather than speaking up about something that could have been managed easily from the start.
So here is the quick, practical framework worth remembering and keeping close, maybe even written down somewhere near your own pill bottles. If you take amlodipine, watch for ankle or leg swelling, especially worse by evening after a full day on your feet, and mention it to your doctor, rather than quietly enduring it the way Walter did for months.
If you take Lisinopril, watch for a dry cough that can start any time, even months in, not just the first week, and watch closely and seriously for any swelling of the lips, tongue, or throat, which is a true emergency, requiring immediate care, not a wait-and-see situation.
If you take Losartan, watch for dizziness when standing, weakness during illness, and signs potassium may be running high, such as muscle cramps, tingling in your hands or feet, or an irregular heartbeat you can feel in your chest.
With Losartan and Lisinopril especially, ask about your lab follow-up schedule and make sure you understand what the numbers actually mean before you panic over a portal result late at night.
With all 3 medicines, mention any over-the-counter pain relievers you take regularly to your doctor, take extra care during any stomach illness or heavy sweating, and never simply assume a new symptom is just unrelated aging without at least asking the question out loud to someone who can actually answer it.
I want to be careful here, because I do not want to leave you afraid of a medicine that may genuinely be protecting your heart and your kidneys for years to come.
Not every side effect means something is seriously wrong, and most of what I have described tonight is manageable, not catastrophic.
Mild swelling, a dry cough, or brief dizziness when a dose first changes can often improve on their own or be easily managed once your doctor knows about it, sometimes with nothing more than a small adjustment.
But not every symptom should simply be endured for months in silence either, the way Walter endured his swelling, or Dolores endured her cough, before ever mentioning it out loud to the one person who could actually help.
The answer is not panic, and it is not quiet endurance, both of which cause their own kind of harm in different directions. The answer is paying attention, understanding the pattern your particular medicine tends to create, and speaking up early rather than waiting until a small, manageable issue becomes something larger and harder to fix.
Think about how many folks live for months, sometimes years, in a kind of quiet fog about their own medicine, knowing the name, knowing the dose, but never understanding why their ankles swell, why they cough at night, or why a lab number moved. That fog breeds a strange mix of fear and dismissal, sometimes both in the same person, on different days.
Once you understand the pattern your particular medicine creates, so much of that fog lifts. You stop assuming every new feeling is a catastrophe, and you stop pretending a real warning sign means nothing. That balance between careful attention and calm understanding is exactly where safety lives.
If this helped you understand your own medicine a little better, share it with someone you know taking one of these three, because there is a good chance they need this exact conversation too.
I am not a doctor, and nothing here replaces what your own physician tells you about your own body. So if something about your medicine concerns you, please make that call rather than guessing. My name is Ezekiel, and I will be here next time with the next plain, honest conversation worth having before it becomes an emergency nobody saw coming.